We are in beautiful Halle with a renowned expert in sudden hearing loss. Professor Plonke, thank you very much for taking the time to talk to us today. When a doctor speaks about sudden hearing loss, what is that? What do you mean by sudden hearing loss?
Well, sudden hearing loss is defined as a sudden, acute deterioration of hearing. This can be a mild hearing loss or severe. It can be even profound or complete deafness on one ear. It may be accompanied by tinnitus or vertigo.
And if I experience this sudden hearing loss, what do I do? Does it go away just by waiting out a few days?
There's many reasons why you can have a sudden deterioration of hearing. So it's important that you see a doctor, and this ENT doctor, an ear, nose and throat doctor, will have an examination and will find out whether there's a reason for your sudden hearing loss. If there's no detectable reason, we talk about a so-called idiopathic sudden sensory hearing loss or idiopathic sudden hearing loss. This is a hearing loss by definition without a known cause.
And let's say I experience sudden hearing loss on one ear. How quickly should I go and see a doctor? Should I go right away? Or should I go to the emergency? Or should I wait for a couple of days because otherwise I'll just be sent away?
It's difficult to say. I mean, there are reasons that can be treated or they should be treated. And this can only be decided when someone has a look at you and your ear. So it's basically recommendable to see a doctor as soon as possible. An ENT doctor, possibly an ET specialist would be the best person to see. So the ENT doctor can evaluate whether it is an emergency, whether it needs treatment, and how fast it needs treatment.
So let's say I've seen my doctor and he told me this is sudden hearing loss. What kind of treatment will I get?
Well, unfortunately, there's no approved drug worldwide for the treatment of sudden hearing loss. However, there's a standard of care that's now out there for more than 40 years, more than 4 decades, that is systemic steroids or corticosteroids, usually given as tablets.
So in several countries, it has been customary to give very high doses of corticosteroids. How did that come about?
In the early 2000s, there was clinical data and clinical evidence from, we say, retrospective data. So looking at the outcome of patients who were treated with a high-dose therapy of steroids. And they suggest that it might be meaningful to give a higher dose of steroids. And doctors always think, more is better. That makes sense. It made sense, and it was put in a guideline. And so, for instance, in Germany and some other countries, we used high doses of steroids for the treatment of sudden hearing loss.
And this was the case for several years, even decades almost. And then you personally did a big trial to see if this is actually a good idea to treat patients with these high doses of steroids. What were your findings?
Yeah, we thought we have now to prove that our hypothesis that more is better is actually right. And we did indeed perform a large trial for many years with more than 40 centers throughout Germany. More than 300 patients were included. Actually, I was pretty surprised about the outcome because, as I said, our hypothesis was that more is better and we just wanted to prove it. But we could not show this, so more was not better. In contrary, there was a strong tendency in the main outcome parameters, or in the main parameters that we looked at for more is worse. And if we looked at those parameters that are more relevant for the patient, so speech understanding, tinnitus, the need for a hearing aid or even a cochlear implant, we had significant, so strong evidence against more is better. Quite the contrary, more was showing worse results than the standard therapy.
And I understand that this study had real-life consequences, that today it is no longer common to treat patients with these very high doses of steroids.
Although we couldn't show what we wanted to show, I think the study was very important because we got rid of an unnecessary overtreatment.
So still the situation is today for patients a little bleak because there is no therapy that has actually clearly shown an effect. But I understand there are several new approaches to sudden hearing loss, and that you are yourself overseeing a trial medically that is testing a very new approach to treating sudden hearing loss. Can you tell us about this new drug candidate?
With this high-dose therapy study, we could also show that the standard of care leaves many patients behind with still a deterioration of hearing and or tinnitus, for instance. So there is still a strong medical need to find better therapies. And exactly as you mentioned, there's an international trial going on in Europe in several countries, and I'm the principal investigator. The trial is based on a substance that has been thoroughly investigated for more than 10 years in preclinical experiments and has shown a specific action on the inner ear and good results in different models of hearing loss. The drug has also been investigated in volunteers in a so-called phase 1 study, whether it's well tolerated. And now a so-called phase 2 trial in patients is going on. What is special about this new drug? Two things. It will be applied not through the vein or as tablets, but directly to the ear in a small amount behind the eardrum, so it has direct access to the inner ear. And the second thing, it's much more specific than the broad action of steroids. It acts on specific cells in the inner ear, and it also acts on specific processes that we observed when an ear loses its hearing.
And this trial is still ongoing, so it would be possible for a patient that has experienced sudden hearing loss to take part in this trial.
The trial is still ongoing. We have recruited almost 50% of the patients that we want to recruit and include in this trial, and it's still possible for patients to take part.
So let's say I'm interested. What is important to look out for, and how do I go about partaking in this trial?
I would suggest that you contact your local ENT doctor. At least in Germany, we have made sure that all ENT doctors know about this trial. Or you can look at the webpage of the sponsor, where there's more information of the trial and also about the centers that can be contacted.
Can anybody take part in this study once they had experienced sudden hearing loss?
Every study has exclusion and inclusion criteria. That's how we call it. And then there need to be some safety aspects. So it's important, it's very important that everything is checked thoroughly, that we have a very high safety level, and that we include the right patients with the right indication. So this will be checked by the ENT doctor or the study team.
Is it important to act quickly also, not just to see a doctor, but also to act quickly to be included in this trial?
If there's a sudden deterioration of hearing, it's very likely that there are processes going on that will lead to a permanent damage of cells in the inner ear that are necessary for hearing. And the drug that is tested in this trial has its action very early in this process. So it's very important that we act quickly and give the drug as soon as possible.
So this sounds very exciting. For my last question, what if you personally would experience some sudden hearing loss, what would you personally do?
So far, we have nothing for sudden hearing loss. We give steroids for 45 years. We don't know actually whether they are effective or not. In this trial, with the new drug that's injected behind the eardrum, you will get either steroids or you will get the new drug. So I'm convinced that it's important that we don't just go on for another 45 years giving steroids whether we don't know whether they are effective.
So thank you very much for giving us so much background on hearing loss in general and your work. All the best for your trial and all your future endeavors. And thank you very much.
You're welcome.